to address this group in support of universal primary care in Bills S53 and H248. My name is Patricia Reid, and as a resident of Addison, Vermont, I am a newcomer to this wonderful Vermont community. There are some people here today who have welcomed me to the Green Mountain State as coworkers and friends. I'm here to implore you, members of the committee, to welcome me as legislators. I think I am an example of the kind of person you want to attract to this state. I am educated, employed, and involved in this community. Additionally, I am one of the 63% of Vermonters aged 18 to 24 who are underinsured. Underinsured means essentially that although I currently carry private health insurance, I do not access care when I need it due to financial barriers. Those financial barriers are so high for me that I am unable to pay my premiums. Beginning February 1st, I will be uninsured for the rest of this calendar year. If I am sick or injured this year, I will treat it at home. As someone with known health issues, prescribed medications, and friends who have been hospitalized for illness treated ineffectively at home, this risk is particularly terrifying for me, yet it is one that I have to take under our current system. It does not have to be this way. If my friend had access to a PCP, they would have prescribed antibiotics earlier, potentially keeping him out of the hospital and in his role as a public servant to his community. My own health issues are minimal and easily treated with regular visits to my primary care provider. A PCP can prescribe me the medications that keep my thyroid regulated, something 20 million Americans need care to maintain. They can also manage my polycystic ovarian syndrome, something that, when gone untreated, will affect my weight, my mood, and even my ability to have biological children. My anecdotes and the ones from others speaking here tonight are indicative of a systemic problem, a problem that we can begin to rectify. With universal publicly financed primary care, we would reduce the need for expensive hospitalizations and emergency room visits by preventing disease and treating conditions earlier. We would support the 61.6% of Vermonters who visit a primary care physician, not a specialist, when they accessed care in the last year. And we would create stability that would take away the unfair questions that I and many people like me have to ask. Should I scrape together the funds to buy my prescriptions out of pocket, or should I use that money to make my car safer to drive? Should I drink lots of fluids and Google how to treat my symptoms, or should I spend hundreds of dollars to have it checked out by a physician? Before I lost my insurance in December, my doctor told me the warning signs for polycystic ovarian syndrome worsening. I'm scared that when this happens, there won't be anything I can do about it. This community has welcomed me with open arms, from the small business owner who replaced my old shoes to the coworker who opened her home when I had nowhere else to go. Vermonters have consistently shown themselves to be a community which values the well-being of many over the profit of few. Our healthcare system should reflect that same standard. We started toward that goal with the passage of Act 48, an act which seeks to make healthcare a public good. Let's continue together. I am proud to be part of this community and am grateful to add my voice to those in support of S53 and H248. Thank you.